Welcome. On behalf of Therapy Ed, it is my pleasure to present this webinar about the value and utility of online practice exams and cohort assessment exams. I'm Rita Fleming Castaldi, a professor emeritus at the University of Scranton and Therapy Ed's Director of Occupational Therapy Education, editor of Therapy Ed's National Occupational Therapist Certification Exam Review and Study Guide, and Therapy Ed's National Occupational Therapy Assistant Certification Exam Review and Study Guide. The author of a number of chapters in these texts and several publications and peer-reviewed presentations about certification exam preparation, and many text chapters and national and international peer-reviewed journal articles and presentations related to disability rights, empowerment, mental health practice, community participation, and historical literacy. I'm also the chairperson of Occupational Therapy Leaders and Legacy Society History Preservation Project. I have several professional passions. Today, I'm pleased to share my passion for helping educators facilitate student success on their MBCOT exam. In this webinar, I seek to provide you with foundational knowledge about key features of Therapy Ed's online assessment exams, which we call the OLXs, and online practice exams for occupational therapists and occupational therapy assistant students. I will be discussing the format, the content, administration, and score report features of Therapy Ed's OLXs that contribute to their increased usefulness and thus greater value when compared to other assessment and practice exams. I'll be identifying strategies for how to effectively integrate the OLXs and online practice exams into students' exam preparation plans, and approaches that are used by OT and OTA programs to help defray the costs of the OLXs and online practice exams. As noted, Therapy Ed is not affiliated with the National Board for Certification in Occupational Therapy, the MBCOT. MBCOT, OTR, and CODA are registered trademarks owned by the MBCOT. It is also important for you to know that any comments I make about other commercial exam preparation products do not relate to the MBCOT or the AOTA. As our professional certification body and professional association, respectively, the MBCOT and the AOTA provide accurate and ethical products to certification exam candidates. Sadly, that cannot be said of all commercial providers. While I cannot name any company, I will describe some of the products and practices that raise concern for which educators and students should adopt the adage of buyer beware. I am proud that the Therapy Ed team is comprised of experienced and well-regarded educators who have established reputations for excellence, integrity, and service to the profession. The online exams and practice exams that I will discuss today are exemplars of this commitment. I will begin by discussing the online assessment exams, which, as I noted, Therapy Ed calls OLXs. These 2-hour exams are exclusively available to education programs to administer to a specific class cohort. They are 2 hours in duration because this administration time was established in response to educators' stated concern that 4 hours is often difficult to schedule. If desired, the 2 OLXs that we have for each, either for CODA exam candidates or for OTR exam candidates, can be administered sequentially to provide students with a complete 4-hour exam. But the way they are structured is that they are 2-hour exams. As you see here, this is the exam item portal. I took a screenshot in which the students would access the exam. How you, as an educator, access the exams for your students is that the program director contacts Therapy Ed, and I'll provide contact information at the end, and gives a list of students. And for each student that is going to take the exam, the student gets a personal access code. And that access code will enable them to take the exam in 2 hours if they don't have a disability that would enable them to get added time. However, if they do have a disability in which they would qualify for time and a half, or a disability in which they would qualify to double time, the access code provided for that student would enable them to take the exam in 3 hours or in 4 hours. So the access codes are specific to each student. These exams are purposely designed to mirror a 4-hour MBCOT exam, which each item containing exactly half the number of items on a full MBCOT exam. They're intentionally structured to be diverse in their critical reasoning and content foci, and accurately reflect the MBCOT's domain percentages. For the first cohort that an education program buys the assessment exams for, they are free. Subsequent cohort purchases are competitively priced at $15 per student. So for the online assessment exam, the OTA one, again, it's exactly half of what is included in the 4-hour CODA certification exam. Therefore, it has 100 single response and 600 multi-select multiple choice items, which reflects half of the 200 single response and 6 option multi-select items that are on the CODA certification exam. Similarly, the OT online assessment exam has 1.5 simulation test items and 85 multiple choice items, which reflects half of the 3 CST and 170 multiple choice items that include in the 4-hour certification exam. The exam items in the OT and OTA OLXs are intentionally authored to be diverse in their critical reasoning and content foci, and accurately reflect the MBCOT exam items 4 domain percentages for the OTR exam and 3 domain percentages for the CODA exam. Our online practice exams also accurately reflect the content and format of the MBCOT exam. The review and study guide provides access to 3 online exams that, again, simulate the complete exam. So these are 4-hour exams. So for the OT review and study guide, there are 3 complete CST items and 170 multiple choice items for each of the 3 exams. So the students get 9 CST items and 510 multiple choice items that are consistent with the MBCOT exam format. The exams accompanying the OT review and study guide include include 200 items that include single response multiple choice items and 6 option multi-select multiple choice items. So there's a total of 600 items that are consistent with the MBCOT exam format for the CODA exam. Like the MBCOT exam, each full exam is designed to be taken in 4 hours, but if students have disabilities, they can take it with extended time. The inclusion of items that are specific to the OTA certification exam, such as the 6 option multi-select multiple choice items, and items that are consistent with the OTR certification exam, the CST items, provide students with a valid and useful certification exam simulation experience. It gives them the opportunity to test their content knowledge and time management strengths and limitations before they take their MBCOT exam. We're very intentional that our exam items accurately reflect the certification exam that your students will take at Prometrics. They're intentionally designed to make sure they have a valid experience. This consistency gives students the opportunity to test their content knowledge and, as I said, their time management and limitation before they take their exam. Unfortunately, not all exam prep companies meet these standards. A practice exams promoted by one company includes CST items that have opening scenes and sections that are not gender neutral as per the MBCOT exam, and that includes information that is not tested on the exam according to the MBCOT content outline. Most disturbing is that the answer choices are structured like the CODA multi-select items, in which the test taker must select 3 out of 6 options. But this is not correct for how to answer the OTR CST items. To correctly answer the OTR CST items, the test taker must answer yes or no to all provided answer options, which are often more than 6. They can go up to 8 options, 9 options, 10 options, 12 options. Thus, students who use this company's exam items to prepare for their MBCOT exam receive false information about the content and future and format of their future certification exam. In contrast, all therapy exam items are authored by OT and OTA educators who are recognized experts in the field. Most are current or former program directors, and all actualize the profession's highest standards. They know and understand the content, question level, format, and expectations of the OTR exam and the CODA exam. That our OLXs and practice exams conform to MBCOT exam content outlines is important and differs again from some other commercial exam preparation products, which often do not reflect the depth and breadth of content that must be mastered for MBCOT exam success. As an educator, it is important to know that some of the products available to students provide exams with major content gaps that can give students a false sense of security they have mastered all the content they need to know to succeed on their MBCOT exam. Rather than contributing to students' exam success, these incomplete materials may hinder it. To highlight the qualitative difference between the CODA and OTR exam, here is an example of a 6-option multi-select item that is formatted to be consistent with the MBCOT CODA exam, and an example of a CST items that is formatted to be consistent with the MBCOT OTR exam. While test takers must have solid content knowledge to determine correct answers to these items, they also need to learn how to use their critical reasoning skills to determine the correct answers for their specific exam within the allotted time. This is where Therapy Ed's course and review and study guides are particularly helpful. Both provide strategies for determining correct answers and managing time, and then provide multiple opportunities to practice these skills. As assessment exams, the OLXs can only be accessed and taken once. However, the practice exams that accompany the review and study guides are designed to be integrated into an exam preparation plan. Once activated, access is maintained for 18 months, and there is no limit on the number of times these exams can be taken. To ensure that the students' content knowledge and test-taking skills are accurately assessed, the OLXs and practice exams provide clear introductions that accurately describe the exam format, content, and purposes. This information positively sets the stage for students' exam administration experience, and that can decrease the potential impact about anxiety about the unknown may have on exam performance. So this is what students first see when they enter the Therapy Ed exam portal. And as you can see, there is a welcome message, and it gives information about how the students can use the information they receive from their exam experience. I purposely authored these introductions to set a positive tone and let the test taker know they will obtain useful information to help them effectively prepare for their MBCOT exam. I have heard from students and educators that the just not knowing what to expect on an exam greatly increases test taker stress, which can negatively impact performance. So this is the opening and the introduction and welcome to the OTR exam portal. And similarly, the OTA exam portal has a similar welcome that describes the content of the exam and how the outcome and results can be used that can help the student move forward their exam preparation in a proactive manner. That's the introduction part. But furthermore, to ensure that the student's content knowledge and test taking skills are accurately assessed, both the LXs and practice exams provide very concrete step-by-step directions on how to effectively answer the OTR exams CST items and multiple choice items, and the CODA exam single response and 6-option multi-select items. Having these directions that the students can follow right on the computer screen as they're taking the test ensure that the student's exam performance is not negatively affected by their lack of understanding about the differences between the distinct exam item types and are not knowing how to effectively answer the different exam items on their respective exams. So this is the screenshots from the OTA exam portal. And as you can see, it provides an overview of what the exam is about. And it gives directions, particularly about the multi-select 6-option items. It also describes no partial credit is given, and it gives information about accessing it through Windows or Mac. The next page, when they actually enter into the exam, provides a bit more, repeats some of the key information, but also gives some advice about not skipping exams, no penalties, how you can use the strike through, how you can mark from review. So again, giving these directions ensure that the student's content knowledge and test taking skills are accurately assessed, not that their lack of knowing about how to use the exam and how to approach the exam. This is an example of how when the student is taking the exam, if they don't follow the directions. So this student only selected 2 options, and it says you must exactly select 3 options. So this way the student does not lose credit by not completely answering the item. These are screenshots of the assessment exam that mimics the OTR exam and includes the simulation test items. So again, there's an overview that's on the first page, and then the directions for the specific type of computer students are using. And then there is more information that goes into CST items, particularly which is notable is you can't leave blanks and you cannot change your answer, which is unusual for students. It also describes the feedback box that comes up when the yes is selected, okay? And again, it tells them how they can go and review the feedback if needed as they progress through the section. Again, I wrote the directions to be as clear as possible to maximize the students' responses. Particularly for the CST items, we do advise students to read everything before selecting the answers, because something that may seem yes initially may wind up having no when a subsequent option is better. For example, 2 evaluations, and there's one that's, would be more comprehensive because you can't change your answer. So by doing that, we help students maximize their points. And the goal is that by following these directions, the students will habituate these test taking habits. So in their prometric, these habits will come naturally. Again, while the students are progressing through the exam, if they did not completely answer the item, they get the warning that's saying, hey, you need to answer this question. So again, we are maximizing students' success so that they have an exam experience that is testing their content knowledge and test taking skills, not their lack of familiarity with the format of the exam. At the end of the simulation test items on our LOLXs, our practice exam, we do the same as the MBCOT. They cannot go back to that section after it's been completed. And then we provide the transition to the multiple choice test section of the item. The clock doesn't stop the same as the MBCOT clock doesn't stop, but we provide directions that are similar to the COTA exam directions for the multiple choice items. So that again, the students can maximize their performance by knowing that they can change their answers, they can mark things for review, and they should make an educated guess and not skip an answer. Skip a choice. In addition to having the OLXs that are only available to programs to give to their students as assessment exam, and the 3 online exams that accompany the review and study guide, the online learning portal also provides test takers with access to mini exams, which are 20 multiple choice items, which are drawn from the full practice exams that accompany the review and study guides. So these mini exams can be used to determine if mastery of content has been attained after studying chapters. So when students are studying for the exam, particularly if their exam preparation is extended, or perhaps they're taking a course in their curriculum, which is focusing on exam preparation and content review, they may want to take a mini exam that relates to the chapter that they have just studied. If their practice exam score reports show that they're weak in a specific content area, they can also ask the portal to pull a mini exam related to the content in which they were shown to be weaker. And the portal will do that. And then after they do that, they can see how effective their study plan is by focusing on those particular topics that need further testing. Upon completing the 20-item quiz, they get a detailed analysis of performance that is the same as the report that it comes with the complete practice exams and with the OLXs, which I will go over in the next section. So the one thing that is critically important with both our online assessment exams, the practice exam, and the mini exams, but more important for the longer exams, is that each test taker will receive a detailed, personal, and confidential exam performance analysis and score report. And I want to emphasize the personal and confidential aspect of our report. That is not true for every exam prep provider. Last year at the New York State OT Association Student Conclave, I was appalled to attend a presentation by another independent exam prep company during which their score report procedures for providing individual scores to students as compared to the scores of other test takers were described. This description was accompanied by a screenshot of this score report. The screenshot displayed the attained scores of a cohort of students who took their exam with the test takers' full names accompanying the listed scores. This lack of recognition that this method of reporting violates student privacy and a code of ethics was striking. and I raised concerns about this process, do know that any score report that Therapy Ed provides to students has no confidential or personal information about any other test taker. Any comparison to other test takers is given as aggregate data. There is no personal information provided. What is provided, though, is information according to the 9 content knowledge categories that align with those in Therapy Ed's review and study guides, 5 critical reasoning skills, and the MBCOT exam domains. The time used to complete the exam and incorrect items are identified. So this comprehensive and detailed feedback enables each exam to serve as a diagnostic tool that can help students identify their content knowledge and time management strengths and limitations. This knowledge can be used by students to develop a targeted exam preparation plan. Exam preparation plan guidelines are provided in Chapter 2 in the review and study guides and greatly expanded upon in our course and in Therapy Ed course manuals. Now, this is an example of a screenshot of a score report based on an exam I did this summer, and I clearly did this far too quickly. I was testing the portal, but I did answer questions I knew. Others I did not know, as clear by my score report, but I did get 72% right. However, as you can see, I had strength in process of OT, had strength in psychiatric and psychosocial approaches, evaluation, treatment, and performance of occupation, pretty good environmental mastery, and professional standards and responsibilities. Okay, this was a CODA exam, so this is why it has this category. In the OTR exam, it's called professional competence and management. Professional management competence, professional competence and management. But you can also see my weaknesses. I was weak in human development and aging because there's a lot of detail about developmental milestones that needs to be studied and mastered. I'm also weak in my musculoskeletal biomechanical approaches, not so good in several of my body systems, including cardiopulmonary, and borderline on my neurological. So this is very specific, targeted information that the student will get. And again, this was the 100-item OTA exam. It also provided me information on my domain scores. And there are 3 domains in the MBCOT exam, and our percentages match the MBCOT item percentages as far as the weight that they are giving in the exam. Now, important thing about a score report, which is why I really think the OLXs offer more than other products. If I received the score report and only about my domains, I would say, hey, I'm doing okay. And I would not have any ideas where my strengths or weaknesses were, because these are very equitable scores. However, because I received information about my content knowledge categories, I know I need to study Chapter 5 about human development and aging. I know I need to study Chapter 6 about musculoskeletal disorders and Chapter 11 about biomechanical approaches. I know I need to study Chapter 8 about cardiopulmonary and Chapter 9, which covers all these other body systems. And I probably should review Chapter 12, which covers neurological and cognitive perceptual disorders and approaches. So this extra information provides me with much more targeted information to develop a study plan than when I just get the domain scores. And I think this is one of the best aspects of Therapy Ed's OLXs. The other benefit is we also cover and we provide information about the type of reasoning skills students use to answer the exams. As we know, the MBCOT exam is not the equivalent of a matching column. Students need to require and use their clinical reasoning and their critical reasoning and to analyze questions in a more complex manner than a matching column. And as you can see, I was weaker in inferential reasoning, which is what is going to be best for the future, and weak in deductive reasoning. So I'll talk more about how students, if they get this type of feedback, how they can use that in a way that can inform their exam preparation. So how are the domain percentages? How can students use the information that's provided about the MBCOT domain percentages? If a domain score is low, so say like my scores were pretty equitable between the 3 domains, but if a student sees that the domain score is low, they should really look at the exam hints that are provided in Therapy Ed's OT and OTA review and study guides. And these exam hints, basically, they're framed in green, and they directly relate how chapter content is reflected in MBCOT exam domains, with a strong focus on the task and knowledge statements that are provided in the OTR or the CODA exam content outlines. So for effective exam prep, students should prioritize their study on the content that we know is tested on the exam. And these exam hints help students do that. How do we increase the utility of the critical reason score report? If students are lacking specific critical reasoning, they should be advised to reflect on the questions in Table 2.5 in the Review and Study Guide and review this chapter's comprehensive information about the relevance and application of critical reasoning to the MBCOT exam. Dr. Kara Induck composed this table and this chapter content and the content that's in our course manual. And she did her doctoral dissertation about studying the type of reasoning students use to be able to take and pass the MBCOT exam. She provides very helpful questions for students to reflect on. What type of reasoning challenge is these questions, their answers to these questions present, and then provide strategies that the students can use to enhance their critical reasoning when they are studying and preparing for the exam. So that's how the students can use their exam reports. Now I'm going to talk about how a program director and educators can use the score report. After a class completes the OLX, a comprehensive report is provided to the program director about the program, class cohort, and individual student performance in those 3 areas that I just talked about. So if you will always get a class cohort and individual student performance. Once you do the exam across more than one cohort, you get a program report. And it's again those 9 content knowledge categories, those 5 critical reason skills, and those MBCOT exam domains, just like the one that is provided to the individual students. However, the program director score report also provides information in these categories, again for the cohort, and students' quartile scores. So are they 25%, 50%, 75 and then in the highest bracket. They do divide student score reports according to when the OLX was administered, like before completing my field work, at the end of my program. And this ensures that students who have not completed their program are evaluated separately from those who have, because clearly a student who has not completed field work or their program will have less content knowledge and critical reasoning skills than a student who has. And this is what the score report looks like. Again, a screenshot. This is from an actual school. Okay, and it shows the percentage of how many students scored in the different quartiles, and it also then has the highest versus the lowest score. And as you can see, then it provides information as to how the students did in each of these categories. Now, this exam was done, and this is just a report of the multiple choice aspect. You also get the report on the CST and then a whole total score. This report was completed for a school in which students was taking the assessment exams and they had not done exam preparation. So that's why the scores are low. And this is again from the same program, and we blinded the student information. But I just wanted to show you so you get an idea about the amount of information you do get. So you do get the raw score, and the max score is 131. And that is because there's 85 multiple choices, and then there's 46 CST items. So that's how the total, and then it also tells you how students did in the CST versus how they did in the multiple choices. Now you can see that this one student did not do well. So I think they must have exited out and not have done the multiple choices. So that is not good as far as the exam prep, but that you would then be able to talk to the student because you would have their name and say, what happened? What happened? Because, life happened, you had to stop the exam, but you want to know what is going on that resulted in this type of score. But for the other students, you definitely can see where they have strengths and limitations. You could also see the timing. Now this school, because they did not have exam prep for the students and they were doing this kind of like as a trial, they did not specified that the students should take the exam in 2 hours. So you would have that students, if they took it in 2 hours, as per the MBCOT exam for what a 4-hour exam should be, that if I'm taking half the exam, I should be doing 2 hours. But if someone has accommodations, they would have extra time. So the amount of time they took to complete the exam and the number of items they answered is reported. And the key is this comprehensive information can be used to help you identify students who may need additional support and or skill development in their critical reasoning, content knowledge, test taking, and time management skills. It can help you determine a class cohort's readiness for their certification exam. And if you start to see patterns across classes and across program cohort groups that, a lot of people are weak in category 3, which is musculoskeletal conditions and biomechanical approaches, but we're really strong in category 4, which is neurological conditions and neurophysiological approaches, and can let you know what are the strengths in your programs you want to keep and build upon, but maybe some limitations that you want to address. And this can inform your curriculum and course development to enhance student certification exam preparation. So those content knowledge category skills can be used to assess, again, your strengths and limitations, because they're very specific. And they provide much more information that can't be gleaned from the MBCOT exam domain scores. I know when I was program director and we received a score once that our evaluation domain scores were very high, our intervention implementation scores were very high, but the domain 2, which is more about planning intervention, were lower. Well, that was very puzzling, because if our students were evaluating well and implementing well, why were they not planning well? So that was a bit of a perplexing thing that we spent a lot of time discussing and trying to decipher. But then it was, okay, are we weak in treatment planning in developmental and pediatrics? Are we weak in cognitive? Are we weak in neurophysiological, biomechanical, psychosocial, or environmental accessibility? So it's very hard to figure out where we needed to improve our program. So having those 9 content categories can really provide more information than the MBCOT exam domain scores. And that can really increase the utility of these for you. And they can help inform, again, your curriculum development to enhance success. To further that, Therapy Ed has available an Educator's curriculum and course assessment. And that is a tool that faculty can use along with the review and study guides. I developed a number of years ago when I was doing a private consultation to a program working on their curriculum development and their course development, separate from exam prep. And then I realized, the review and study guide provides a very good tool to help organize that. So I developed this tool, and because it uses Therapy Ed's review and study guide, it is now distributed by Therapy Ed. And basically what it does is it provides a structure to assess the content of your curriculum and determine the specific content that should be covered in individual courses. And this can also help you meet the new accreditation criteria that states that faculty must demonstrate awareness and understanding of how the program's curriculum design is integrated into the program. By having everybody go through and use these forms, you really will see who is covering what and where you're covering it and how you're assessing it. And people really get a feeling of what is the curriculum like and how is design actually being actualized within the courses. So if anybody would like to receive that, you can just email me and I'll provide my contact information at the end. A key question that comes up is, when is the best time to administer an assessment exam? Of course, this is very program specific. The one thing that is helpful is that Therapy Ed does have 2 OLXs, 2 OT OLXs, and 2 OTA OLXs. So this does provide the option to administer exams at different points within a program to obtain information about your students' exam performance that's most relevant to your program's specific needs. So some schools do a post-academic coursework, pre-field work structure. Some do post-field work, pre-capstone, pre and post fieldwork, pre and post Therapy Ed exam prep course. So there's a number of ways. And again, we can discuss that as to what works best for your program. The key thing to always remember, no matter when you administer an assessment exam, whether Therapy Ed's OLXs or MBCOT's OTKey or some other product, do know that the content knowledge required for MBCOT exam success is extensive. Therefore, the class cohort and individual student OLX scores will reflect the amount of exam preparation they've completed prior to taking this exam. So if the students take the OLX before they complete their didactic coursework or their field works, they may not have the foundational knowledge they need to correctly answer all exam items. And even if they have that foundational knowledge, if they haven't studied and their PEDS course was several years ago, they may have gaps then in developmental. So the key point is when you analyze the OLX scores or any assessment exam scores, you should place them in a temporal context as to where the students are in their exam preparation. To obtain the OLX exams, you order them directly from Betsy Pendry, and you give a list of the students and again identify whether they need extended time or not. And I want to talk about briefly about defraying the cost of assessment exams. These are some strategies that some OT and OTA programs have done to defray the cost of the exams. Some have included the purchase of the OLX in their accreditation budget, and some have integrated the administration of the OLX into a pre or post fieldwork course, which enables the cost to be budgeted as an instructional expense. Many programs have found that by going to their dean and their financial managers and explaining how these resources can help increase students' exam pass rate, that administration is amenable to including these items in accreditation budgets or having flexibility that this is included in a course. We know that the gold standard of publishing pass rates is one that programs are concerned about to make sure they have an acceptable pass rate. And also administrations are concerned about pass rates, that they want to make sure that the pass rate is such that they can attract potential future students. So this is one mechanism by which program directors have been able to get the OLXs covered in their budgets. So after reviewing the assessment score reports and identified strengths and limitations, students should be advised to proactively address identified content gaps and areas of concern. Therefore, I'm going to talk briefly about post-assessment exam resources that can enable exam success. And therapy ed resources that can help students acquire essential test-taking skills, learn needed content, and practice the application of these abilities include our online and on-campus exam preparation courses, our review and study guides, personalized tutoring, online office hours, which include weekly content review sessions, and an exam item of the week. I'll go over these briefly to just highlight a few of these points so you can inform your students about these resources. Therapy and certification exam preparation courses specifically recognize that there are two aspects to student certification exam success. One is mastering the content they need to know via a targeted study plan. The other is knowing how to select that best answer to exam items using critical and clinical reasoning skills. Therapy Ed's comprehensive and interactive courses address both these critical components for exam success. They do a lot of learn by doing. We do follow the mantra of OT, that we learn by doing. They are extremely experiential. It's important to know that the course fee includes the review and study guide, both either the 9th edition for the OT or the 4th edition for the OTA. And remember, each review and study guide includes access to those 3 full exams and the mini exams, quizzes. Each course also includes a 200-page course manual that provides a roadmap to the review and study guide. Basically, it's myself and other therapy ed instructors and contributors walking the students through the review and study guide and highlighting what is must-know information and how this information will be assessed on the exam. The manual also includes extensive study hits and numerous self-assessment and exam preparation forms that the students can use to develop their prep plan. Important thing to also know is that Therapy Ed allows free retakes of courses if students are not successful in their pursuit of their certification exam, or if they have significant extenuating circumstances, like their exam was delayed for many months due to family issues, COVID-19 issues. Some course information that can also save some money is to know that if students separately purchase the review and study guide from Therapy Ed, or if you're a program that provides the review and study guide to the students, but not the course, do let the students know that the purchase price is credited toward the course registration fee. So the amount of the review and study guide is deducted from the course registration fee. Also, if your school hosts a course, you do get a discount for your students So each student is registered at a less expensive level. They get a discount than students who are not affiliated with your program. And that is true whether you are paying for the course within your budget or if the students are self-paying. Okay, so you still get a discount for your students. To help defray the cost of the exam prep courses and the review and study guides that accompany the courses, OT and OTA programs include the purchase of the course in their accreditation budget. Again, having that the students are more effectively prepared for the exam can increase your pass rate. So deans are amenable to including that in the budget often. And they've also sometimes integrated the offering of the therapy ed exam prep course into their curriculum or a specific final cumulative course, sometimes called professional development, in which other aspects of becoming an occupational therapist or a certified occupational therapy assistant are covered, including passing the exam. And this enables the cost of the prep course with the review and study guides to be budgeted as an instructional expense. I just want to highlight a few review and study guide features that increase their exam preparation efficacy. They are efficient. Having a single text that synthesizes all the content knowledge that may be tested on the MBCOT exam simplifies exam prep and saves time. I've had many students talk about going down the rabbit hole of all the different information of study cards and PDFs that are available. It does get overwhelming, the amount of things that are available. Then it also gets expensive. Purchasing multiple products is expensive. And so one product that has it all can save students money. The all-inclusive nature of therapy as reviews and study guides, though, can make them appear daunting. They are big. It's important to recognize that half of each review and study guide is devoted to extensive rationales about the correct and incorrect answers to the 3 practice exams. And the other thing to always remind students is, again, the review and study guides include 3 full exams. There's also multiple tables and figures that highlight must-know information and support visual learners. And the new editions, the 4th edition of the OTA and the 9th edition of the OT, have new features that highlight must-know information. I'm just going to do a show and tell on those briefly. I talked about the exam hint boxes that place chapter content into the context of MBCOT, exam outlines, domains, tasks, and knowledge statements. And they also place it into context of the practice analysis. So we really help students learn what they need to target for when they're studying. Because the MBCOT exam is a licensure exam, both MBCOT and licensure boards want to make sure that practitioners are safe. Therefore, we have added red flag boxes that highlight in framed in red unsafe actions, contraindications, and serious risk factors that are known to cause harm, and things that require an immediate response to ensure the person is safe and well. And those are, again, framed in red. And then we also have caution boxes that talk about precautions and contraindications and risk factors that may result in harm or don't reflect best practice. And these, again, are highlighted throughout the book to help students focus their studying. At the ends of the chapter contents, which are 3 to 15 in the OTA review and study guide and 3 to 16 in the OT review and study guide, in both texts, chapter 1 is about the exam and the format and content of the exam and how to best answer the questions and determine the best answer. And chapter 2 is about doing an exam prep study plan and also the application of critical reasoning. So in the content chapters, again, 3 to 15 or 3 to 16, at the end of each chapter, there are open-ended questions, and there's a couple of examples here. And they're provided to help the test takers jumpstart the thought processes they need to apply their studying of chapter-specific content to the answering of exam items. Comprehensive answers are provided in each text in the appendix. And these questions are meant to engage the test taker in thinking about the knowledge acquired from each chapter. Thus, they're not an objective exam format. Some educators have found that using these chapter review questions to be very helpful if they do a course that is a content review course for the MBCOT exam. So they have that the students review specific chapters during the content review course, and then they have the students post their answers in a discussion board in an in-class activity if you're in class, and they have found that to be very helpful in getting students to, again, develop a mindset for what they need to study for the MBCOT exam. Some purchase information cost saving hints. I strongly advise you and your students not to purchase the review and study guide from third-party vendor, such as Amazon. The price is often very highly inflated, and the most significant thing is there's no guarantee that the student will receive a valid code for accessing the online portal. And a big economic benefit to Therapy Ed's review and study guide is access to those 3 exams. You don't have to buy a separate product. It's all included with the book. So quickest and most economical way is to purchase the Therapy Ed review and study guides from Therapy Ed. You can also receive bulk order discounts and definitely a program review copy as an educator. And that again is through Betsy Pendry. And in addition to bulk purchases, as I already meant, like including the review and study guide and a course that may be paid for by the program, you can also integrate it into a course that is already, required a recommended course in the curriculum, and then or have the bookstore order the review and study guide. And both of those strategies enable that students can use their financial aid or bookstore credit to purchase their text. Additional resources, just to highlight, is our online office hours, which are every Tuesday, and they are free. Each session begins with a targeted content review, such as top 5 must-know content, which is followed by an open question and answer session. And that could be about any questions students have about exam preparation and how to receive advice on how best to prepare for the exam. They are hosted by an experienced Therapy Ed OT instructor who is an OT educator and a content expert in that evening's topic. Therapy Ed also offers private one-on-one tutoring or small group sessions, which sometimes schools provide to a group of students who sometimes are struggling. And it's based on student preference and or program preference. They are fee-based, they are an hour. And the important thing to know, they very much individualized for the student's specific needs and challenges. And an experienced Therapy Ed instructor provides these tutoring sessions. And they are very dedicated to supporting the students. But the one thing that's very important to know is there is no pressure for students to buy extra sessions, and there is no one going to be calling them to buy extra sessions, which sometimes occurs with other products. And they really are designed to help candidates prepare, take the exam for the first time. The mantra is one and done, take the exam once and be done. Or if they were not successful the first time, how to modify their strategy so they can pass the second time. This is the schedule of our content review sessions that we've started in August, and that will conclude in January. And as you see, we cover a diversity of topics that is reflective of content that is on the MBCOT exam content outlines, both for the CODA exam and the OTR exam. We do publish an exam hint item of the week on social media, and they are original items that the focus of which is related to the following week's online office hour content review session. So the items posted on Thursday, the answers provided on Sunday, and on Tuesday, the Therapy Ed course instructor, who's a content expert on the week's topic, can answer questions and provide more information about the item's correct and incorrect answer. The other additional Therapy Ed resource that's worth noting is our YouTube channel. This is where the recordings of the office hours content review sessions are posted. They are typically posted within 2 days of the session and remain online for 1 month. And the office hours session on the application of mindfulness to certification exam preparation, which is presented by Donna Coster, is permanently posted, and that is quite beneficial to students. We also have posted inspired 2021 webinars that we have completed about MBCOT certification exam process and Therapy Ed's exam prep resources. There's also a recording of the audio of the Education Summit presentation I did last fall about helping ensure student certification exam success. And this presentation here will be posted on the YouTube channel. And there's also a published video about feedback from exam candidates and educators about the efficacy of Therapy Ed's exam prep resources. I'd like to end by just reflecting on Therapy Ed's culture of collaboration, because that is what I'm very proud to be part of. From its inception, Therapy Ed has viewed collaboration with OT and OTA educators and giving back to the profession as key to success. Hence, Therapy Ed has sponsored AOTA events, ALC events, Student Conclave, Ed Summit for decades, the national conference. Therapy Ed is committed to supporting AOTA. Because all members of our team are educators ourselves, and we value working with our colleagues to ensure our profession's future practitioners succeed on the MBCOT exam. And we deeply respect and highly regard the longstanding relationships we have established with OTA and OT programs nationwide, and welcome the opportunity to forge new collaborations. There are many programs that we have been providing courses to for over 10 years and several now up to 20 years. To help you and to have this, to foster this culture of collaboration, our team responds in a timely manner to all questions and concerns that we receive about exam preparation or products. We provide free certification exam content review sessions and exam prep webinars. In January, I'll be doing a frequently asked question about effective exam preparation and answers that will be provided to students. We also provide periodic exam prep course refresher sessions for students who have taken our course, our full day OTR CODA course, a full day course for the CODA exam, and our 2-day course for the OTR preparation for the OTR exam. But we recognize that some students have had significant delays due to COVID. So we have offered refresher sessions periodically for them so they can get back into exam preparation mode. And those are free. And we also offer free webinars for educators about strategies and resources that you can use to help your students develop the knowledge and skills needed for exam success. In April, Kara Inda will be doing a free webinar for educators to attain that goal of focusing on constructing exam items to enhance academic and certification exam performance. And we'll be sending out an announcement about that shortly. In conclusion, I'd like to reflect on the fact that the Therapy Ed team recognizes that there are many exam preparation products available from other commercial exam preparation companies. Thus, we ask you to consider the following questions prior to making a purchase for your program or recommending a product to your students. Does the exam preparation product include current and accurate information about the NBCOT's OTR and CODA certification exams content, format, and procedures? Does it include comprehensive, organized, and well-integrated content that is directly related to the NBCOT content outline for the OTR or the CODA certification exams? Does it include effective test taking and time management strategies to help students correctly answer exam items and successfully complete the exam within the allotted time? Does the product include practice exams that accurately represent the different types of exam items they will be required to answer on their respective certification exam? And most important, is there real-time experiential learning opportunities and individualized live supports provided? And most important, as an educator to me, are the product providers experienced and well-regarded educators with established reputations for excellence, integrity, and service to the profession. The Therapy Ed team and I, as a representative Therapy Ed team, are very proud that the quality of our products and resources and the expertise of our course instructors and tech contributors will enable you to affirmatively answer yes to each of the above questions. I look forward to chatting with you more about these resources. Please feel free to contact me at rpcot@yahoo.com if you have any questions about how to best integrate Therapy Ed's OLXs and/or practice exams into your curriculum. If you have any questions about how to effectively use our review and study guides in your program to develop students' content knowledge for exam success. If you have any questions about how to apply our educators' curriculum and course assessment to assess your program content, determine specific course content strengths and limitations, and foster faculty's knowledge of programs, curriculum, content, and design. You can also contact Betsy Pendry at bpendry@therapyed.com to obtain purchase and discount information about the assessment exams, the exam prep course, our review and study guides, which include the practice exams and individual and/or group tutoring, and to schedule an assessment exam and an in-person course or virtual exam prep course, and/or personal and/or group tutoring. I thank you for your time and attention, and I look forward to working with you and your faculty in the future to help ensure your graduate certification exam success. Thank you.